Welcome to Health Reform 2.0, the only place on the internet for people with a curious mind and a desire for a better healthcare system. Here we take you on a journey of our current quagmire, tell you where it came from and why the government can't fix it. Along the way, we'll tell you some history, bust a few big myths, tell you a few stories, and give you an idea how we can work together and get the healthcare system we want. Let's get started.
Welcome back, ladies and gentlemen, to another edition of Health Reform 2.0. There's a lot of talk today in the news about drug pricing. Secretary Azar has just gone out, and finally someone has decided to start talking about rebates, and he's talking about how they're going to cut rebates to PBMs, that's pharmacy benefit managers. So we're going to talk to you today about drug pricing. We've talked to you about this before, but today it's important for us to really start to focus on drug pricing. And this is a special episode. It's coming before the next episode in our series because we believe this topic is very important for you to understand as this debate transpires, or we're all going to get boondoggled again. Now, as you can see, I'm joined today with my partner in crime, Tim Henning, and I'm going to turn it over to Tim and have him pick up from there.
Thanks, Tom. Good to be back in the studio. Fire's not going today.
Yeah.
Before I get started, I've got a curious mind. So yesterday I was sitting around and I heard some reports about the net worth of our Congress people. You know what the average salary is for a Congressperson?
$176,000.
Yeah, exactly. And but then I kind of started thinking about some of the reports I heard on some of the individuals and what their net worth was after they got elected. So I pulled up some data. Now, this data does not indicate if they inherited the money, if they earned it through some other business, like Darrell Isis is the richest congressperson there is.
Right.
But he has 5 or 6 different businesses.
Yeah, he earned his the legitimate way. He grew it from nothing.
But let me give you some data. I don't even know who these people are. This is the net worth increase from the time they got elected till 2018. And this comes from the Office of Inspector General. A person I've never heard of before, Shelley Pingree, Democrat from Maine.
Yeah.
$40,450,000. 73,000% from when she walked into office. Give you another one. Patrick Murphy, 144.9%.
He's Florida.
1,449, Democrat from Florida.
Yeah.
Roy Blunt, 147%. The list goes on. Why do I bring this up? It pays to be in Congress. And I'm not so sure it pays just because you have a business on the side.
No, it does pay to be in Congress. In fact, and we'll step aside for just a second. This kind of semi-relates to the drug pricing thing. When the government was first formed by the Founding Fathers, they were to be citizen politicians. They didn't get salaries. They just got expenses and per diems. They were on the job as a congressman for 4 months, and then they were off for 6 months to go back to their home district and make a living. And then it rotated. They would be on for 6 months, and then they would be off for 4 so they could go back to their business and make a living. That was how it was done. It was built so people that became Congress people had the responsibility in their district, had businesses in their district. That was the idea. So any laws they passed affected them equally. In the 1940s, Franklin Roosevelt extended Congress to be more or less full-time. It was supposed to be a temporary extension. He needed to have them there longer to pass a number of bills related to the Depression and the likelihood of war. So he needed more time out of Congress, and he put them in the job, if you will, for a much longer period of time. They were then to be on for 9 months to 10 months and off for 2 to 3. Well, of course, FDR died. And after FDR died, what did Congress do, Tim? They made the change permanent.
They made it permanent.
They made it permanent. They made the salaries they were getting permanent, and they made the time period they were there to be permanent because they really wanted to be professional politicians and not have to have that messy stuff of going back and passing a law and figuring out whether that affected them or not. So we ended up with this professional political class. And today, we've got a number of problems in our economy and in healthcare that are derived directly from the fact that we have a professional political class.
Mm-hmm.
And drug pricing is a great example. They don't want to look too far below the surface of how anything works, because if they do, then they'll know it's not right. And if they know it's not right, then they have to supposedly come back to tell you it's not right and how it needs to change. So they create all these things.
Right.
They bury them in BS. And then as we go forward, we've built a series of policies in healthcare that really are predatory. That's why we talked about predatory and dangerous.
Exactly.
And drug pricings and how they are created are clear example.
A very clear example. But don't want you to know, ladies and gentlemen, look over here. Look at this bright, shiny object. Oh, don't look over there. No, we don't want you seeing that. No, we don't want that exposed. I want to show you a bunch of sound bites.
You know what Dorothy said in The Wizard of Oz?
Yeah.
Pay no attention to the man behind the curtain.
Exactly. And that's what they are. So we're going to expose that. So given the recent focus, as Tom mentioned, the political posturing, the misinformation, the media coverage over pharmaceutical drug pricing, we decided to address this issue in this episode. So how did we get here? Well, the answer can be found in this country's shadowy system of drug prices and rebate deals, the focus of this episode. The system contains odd and perverse incentives. We're going to really get into that, with the result that higher priced drugs can receive more favorable health plan coverage, channeling patients toward more expensive drugs. When we are done with this episode, you will hopefully see the truth, that it is government that got us in this mess. And if you think they can fix it, you're dead wrong.
Exactly. You know, Tim, viewed from a global perspective, the U.S. spends more on prescription drugs than just about anybody else. Now, again, this is the general perspective. This isn't reality. The average cost, the way they get reported today, are about $1,100 per person per year. More than anything else in the world. So in other words, we're spending $1,100 more than anybody else is spending for drugs. Cancer drugs in the U.S. routinely cost about $10,000 a month. That is what the invoice price is for those cancer drugs. Now, you'll see on the screen a chart that tracks the growth of drug pricing and inflation-adjusted per capita spending on retail prescription drugs over time. So you've seen they've continued to increment year after year after year. Then now we have up on the screen what the prescription drug expenses are in the United States from 1960 to 2018. This is in billions of US dollars. And again, you can see that the price of drugs in the US has incremented up very steadily. And we believe, that's what we have been told by everybody, that these prices are going up because drug manufacturers are charging more and all these things are going on. Now, at the end, we're going to tell you that's not really the case. Yeah, drug manufacturers have charged more, but there's a fundamental reason why they've had to charge more. And it doesn't come down into things you think it does.
It doesn't. And so one caveat to that, there are some bad actors. Remember that guy that bought that company and then raised the cancer drug by like 500%?
Yeah.
He's in jail now, thank you.
There are bad actors. This isn't trying to put a whitewash on the drug business. There's many good drug manufacturers and there's a few bad apples in drug manufacturing. And again, if all you rely on is the retail price, if you look at it, you'll go, oh, these drugs are really expensive. You know, you can go out in the world and you can buy a car and they have a list price. And have you ever paid list price for a car?
Never.
No
one pays list price for my MRI machines.
Exactly. The list price is a marker that is used to negotiate the discount from. And in general, pricing works, in just to give you some background, if I'm a retailer and I sell blue jeans and I buy them from a distributor and the distributor buys them from Levi's and then Levi's manufacture, Levi's typically is going to mark up the price of those blue jeans 300%. That's 3 times what it costs them to build them for the retail price. Now that sounds exorbitant, but that's the retail price. And what happens in the middle is Levi's, to get it to you, the customer, in effect has to pay through margin between 9 and 13% to a distributor and about 50% of the retail price to the retailer. Now, retailers expect 50% gross margin in the product. Typically, they live on 38%, 35%. So you can expect you're going to get a discount when you go out and buy those jeans. For the most part, they're on sale a lot of times. And the drug business is similar to that, but it has a wrinkle in it we'll disclose in a few minutes that makes it much more dangerous, much worse, and it's why the price is incrementing every year.
So did you ever notice, and we're going to get into it in a little bit because it's going to be pretty obvious to our listeners, you go into Macy's, which I dread doing, and you see a product, and it's discounted 60%. Why do you think that is? It's like changing your list prices right before a sale.
It's called markup to mark down.
And we see this all over. Just wait till you see what we explain what happens in the drug industry.
Oh, yeah. Yep. So again, part of the price increase is clearly because manufacturers have tried to make some more money, often to cover costs that they have associated with selling the drug. But a major portion of why these drugs go up is something we're going to talk about in a few minutes.
So prescription drug pricing in the U.S. began to surge in 2014 after 6 years of increases held down to the spread of genetic drugs.
Right.
It rose 8.5% in 2015 and 4.8% in 2016 before now flattening out, although we're going to see, based on the certain current projections, a rise again in the pricing. Every pharmaceutical company has basically said that. Unlike other nations, and here we go again, we're going to get into this when we start talking about the different systems around the world. Unlike other nations, the U.S. doesn't directly regulate medicine prices except for one thing. In Europe, the second largest pharmaceutical market after the U.S. government, their governments negotiate directly with the drug makers to limit what their state-funded health systems pay. Now, this is a very important point, ladies and gentlemen, and we'll explain that here in a few minutes. For most outpatient drugs reimbursed through Medicare, Medicaid, public health, S-CHIP, and other health programs for the poor and underserved, drug makers must provide the U.S. government with rebates.
So, in effect, what's happening is the drug manufacturer sells that drug to a distributor. And there's a number of them. There's 4 or 5 major pharmaceutical distributors. They buy the drug, and then they sell it to a pharmacy. And they are allowed to mark that drug up from what they paid for it to the pharmacy. Not as much as you would see in a pair of blue jeans by any means. But then it gets to the pharmacy, and then the pharmacy effectively is supposed to sell it to a customer. And if you look at the retail price of the drug, you would assume that the distributor made a good amount of money and the pharmacy made a good amount of money. The reality is the distributor isn't making any money distributing drugs anymore, for the most part. They really aren't making any money distributing the drug. And pharmacists aren't making any money selling the drug. Pharmacists make their money by getting what are called fill fees. They fill the prescription under some insurance program or some state or federal program like AIDS Drug Assistance Program in California, and they get a fill fee. And the fill fee is what makes it worth their while to fill that thing and provide that drug to the patient. Where they're making most of their money is that they sell other crap in a pharmacy. And on average, they make $40 for every prescription that they sell in extra sales in the pharmacy of profit. That's the average, $40 of profit per prescription. That's why pharmacies don't care about making any money in the pharmacy itself. And it's frankly why pharmacies have shown up in grocery stores and other places, because they're now getting a cut of what's coming through the door when they bring in customers as patients.
That's why CVS sells liquor and food.
Right. So it's the problem in this thing is that everybody thinks there's money along the way. Well, there is money along the way. There's a lot of money along the way. The distributors don't make any money distributing the drug, but they do make money on rebates, volume-driven rebates. Mm-hmm. And if they hit a certain level of distribution of a drug, they get a big check. And the same thing goes up. Now, the average pharmacist doesn't get a rebate, but CVS gets a rebate. Right. Large chain pharmacies get rebates. So you got rebates at the distributor, you got rebates at the distributor, the pharmaceutical, large pharmaceutical chains. You also have companies called PBMs, Pharmacy Benefit Management Companies. Mm-hmm. And what they do is they administer the drug costs and reimbursements for patients and insurance companies for various drugs, various programs. In fact, almost every PBM has access to manage the process for any drug through almost any pharmacy.
You've been listening to Health Reform 2.0 with your hosts Tom Locher and Tim Henning. We hope you found the topics interesting, that we answered a few questions, that you laughed a bit and were entertained. Please feel free to invite your friends to join the discussion, and remember, hit that like button and don't forget to subscribe. Send us your questions to info@hr-20.com. We hope to see you again next time.